The following podcast is by Dr. Shawn Weiss, President of Senior Health and Wellness Group on the Answers for Elders Radio Network. And welcome back, everyone, to Answers for Elders Radio. And this hour has flown by as I have had the honor and privilege of speaking with Dr. Shawn Weiss. And Shawn is the president of the Senior Health and Wellness Group, which is an education and consulting company that works with families all over in helping to navigate senior care. And Shawn also, believe it or not, owns a home health care business as well, and has for a long time. And I have been honored to know you, Shawn, now for well over 10 years now. It's kind of crazy how our lives are kind of paralleled and things like that. So I'm so glad you've been able to be with us this hour and share your wisdom. And I know you'll be a wonderful asset to our expert team as we roll out nationally throughout all of our podcasts in the U.S.
Great.
So, Shawn, I really want to start with where we left off with fall prevention, because that's a piece of it where people have been during the pandemic. And I think I want to wrap up this hour kind of where are we at right now? We have a new Delta variant that's out there. There's all different types of things happening. So picking up where we left off, obviously inactivity, you made a comment which is really profound to me. Inactivity produces pain.
Right.
So tell us a little bit about, we've had seniors that have been inactive for quite a while.
Right. So not only do you have, our seniors and older adults have been inactive, but over the course of probably the first half of the year, there's, maybe have been isolated, have not really gone out. They're weaker than they realize they are. Their balance might not be as great as that used to be. And they're trying to go out, trying to get out more. There's that longing to get outside and go do things, maybe go with their son or daughter to shop or go to a restaurant. And, you really have to pay attention to how much have you been exercising? How much activity have you had? It's, the saying, use it or lose it is so profound in this situation, because you might not even realize that you've become weak until you go out to do something and you've gotten maybe short of breath, or you just have to sit down and take a break. Yes. We're seeing it everywhere. Yeah, definitely. And
and I was going to say, for me, I've noticed, early in the season, I have rose garden, right? So I'm out there usually for hours at a time. Even now, of course, part of it is me getting older, but I can't do the things that I used to do. And it's frustrating. It's very frustrating. And part of it is my age, because I'm obviously where I'm at. But I think the other thing is that we just kind of let ourselves go during the pandemic in many cases. And certainly, my doctor asked me how much alcohol I was drinking. And I was like, well, I guess more than normal. I wasn't taking care of myself as much as I normally do, which is kind of interesting.
Right. And you see that across the board, not just in older adults, and everybody. And like we've been talking about this whole hour, whether it's caregiver burnout or the reasons why there's been an increase in alcohol consumption. We see a lot of doctors starting to ask about that. There's a genuine concern about the lifestyles that we've been leading over the past year and a half. And some of it's, we really have had no choice. When if your state was on a stay-at-home order, then you had to try to make do with what you had. And sometimes you don't have the opportunity to go exercise or take a walk, or you didn't really know what you could do at home to try to keep your muscles strong and active.
So with this Delta variant, obviously, there's a lot of confusion happening right now. So what's the scoop on it? What's the truth?
Well, I wish I could say that I am all knowing, and, even as a home care agency owner and a Medicare provider, we have to be really up to all the regulations and all the recommendations. And I know the latest recommendations from the CDC, and there's just a lot of confusion and a lot of worry out there. And, speaking personally, just from our agency, we go from, the pandemic where we have all of our strict rules in place for infection control and trying to advocate for the well-being and safety of our seniors to, okay, well, now people are getting vaccinated, or now the orders are lifted, now the businesses are open and people are starting to get out and do more things. And what we're seeing now is, okay, well, now we're seeing an uptick in cases again, even amongst caregivers and medical providers and people going to the hospital. So we're kind of, at our agency almost had to come back to step back a little bit and let's revisit where we are with our recommendations, and let's revisit where we are with taking care of our seniors and making sure, we're recommending staff get vaccinated, that we're checking for family members vaccinations. And most of our patients are vaccinated. Most of the elderly population that we deal with have been, but there's a lot of fear out there right now. And, we're kind of seeing it start to go back again. And, certainly that creates a level of panic in me as a caregiver or a provider. And you don't want to go back to that situation where people are becoming sedentary and isolated, because I tell you, the mental health and the physical health component of the well-being of everybody certainly has been significantly affected. And we really don't want to go there. We don't want to go back there, but yet we have to be safe. And so we have to, as a home care agency, advocate the best we can for our families to get the care for their loved ones that they need, for our patients who are living alone to still get the care that they need, and I think, provide a safe environment, a safe situation.
And I think too, is, we always say, and I think we're all guilty. I'm guilty as say, I listen to science. Well, science is not an answer. Science is a process of discovery. And I think one of the things that people will say to me, well, the CDC said this a month ago, why did they change? Because we learned more. We learned about, new things. So it's like, I think the thing that's interesting about how we frame things and how we discuss things are in many cases driving society apart, because people hear what they want to hear, and they take their own twist to it. So having the opportunity to say, science isn't the ultimate answer. Science is about discovery, and it's about presentations of the facts as we know them at the time. And we're always learning more. If we ever just shut the door onto science saying, well, this is what COVID is, we wouldn't know more things. We wouldn't be able to discover things about a vaccine or things like that. So understanding a little bit more about, that we all have to be open to what the process is and what we learn. And, but that doesn't mean we have to be confused. And it doesn't mean also that we have to live in fear, which I think is the other side of it.
We're in a much different place than we were a year and a half ago. And, that's the hard part. We don't know what you don't know. And now we know what we know, right? And we still have a lot to learn. I think, 6 months from now, this conversation might be different. It's just we
may have to get a booster shot. And for those of us that have been vaccinated, I've heard that. And that's okay. It's like, I guess my point is, I'm lucky here in the state of Washington. I think we are like about 80% vaccinated, which is really amazing in our state. But there's other states across the US that are not in that position. And it's frustrating coming from where I do in Washington state to see the low numbers, because I don't understand why, but I think it really shows the confusion in the country. And it's frustrating, I think, on all ends.
And you see that, a national rate, what are we, about 70% as a nation? But, coming from a national perspective too, it all depends on, your level of confidence, your level of fear on where you're living right now. So having to, be a provider of education and recommendations for the health and well-being of so many people, it's just is really difficult. I don't think there's a right or an easy way to get people to come together, but I certainly think that the division certainly is not necessary, and it's just only going to be to the detriment to the health and well-being, especially older adults and their caregivers.
Yeah, and I do know that it's like 96% of those that are in hospitals, I think the latest data are those that have not been vaccinated.
Correct.
And that is the thing I think that's really overwhelming to look at. And here's my other question. And I haven't even asked you, I don't even know if you know this, but answer, but what about small children that haven't been vaccinated yet? What is their risk factor to the Delta variant? What have you heard? Like a lot of our seniors have grandchildren.
Right. And what we're seeing right now, and this is the information that we've been provided, is they're still gathering information. As of right now, they're not seeing that the younger children are at as high risk for developing the variant or transmitting the Delta variant. They still seem to be in a low risk pool for that. But like I said, I think over the last couple of months, we're just gathering so much information on this variant and whether now they're coming out and saying, okay, we really feel that all the vaccines now are protective against this variant, which is, wonderful news. We want to hear that. But
if we contact it, it'll be like the flu. It won't be anything, terrible, which is good.
Right. If you're vaccinated and you do happen to get a breakthrough, to have a breakthrough case, your chances of hospitalization or death are little to none. We do know that for a fact. So promoting that because no vaccine is 100% effective, and I think that's also misinformation. That I'm not going to get the virus. Well, you might get the virus, but your chances, you're likely going to have a very mild case of the virus. So you said like flu symptoms, slight fever, headache, a few days of not feeling well.
So, Shawn, I want to close out this hour and make sure that everyone knows that you are going to have your own, matter of fact, you're on answersforelders.com. You are on one of our specialists, and you have a lot of resources on your website, and we can certainly link to that on Answers for Elders. So for those of you that are listening to this podcast or listen to our radio show, please know that we would really love to have you reach out to Shawn. And I'm just so thrilled you've been with us this hour. Thank you so much. And I look forward to a lot more podcasts on our podcast network with you. So in the meantime, Shawn, thank you so much for being on this show.
Oh, my friend, it has been great. And I'm really looking forward to our new adventure together. And again, just helping our older adults age in place and, helping everybody navigate through these trying times. It's going to be a great opportunity. And I'm looking forward to working with you on that.
Hey, I love it. Great. So to each and every one of you, again, stay safe. And we're very, very thrilled that we've had an opportunity to meet this brand new guest. And to each and every one of you, remember, look in on the seniors in your neighborhood. Offer them a glass of water, or maybe it's a lemonade. Think about how you can help brighten their day. And remember, so many of them have been quarantined for so long. So if you can reach out, touch someone, say hello, bring them a smile. And until next week, everyone, be good to each other. We would like to thank you for listening to this podcast by Dr. Shawn Weiss, CEO of Senior Health and Wellness Group, focusing on wellness and prevention strategies for seniors. As a fall prevention specialist, Dr. Weiss provides family support and education to keep your loved ones safe. You can learn more by visiting her website at www.seniorhealthandwellness.org.